Welcome back, everybody. So many of those narratives around the COVID-19 pandemic have completely fallen apart. And all of that stuff telling us that the vaccine would stop the spread, that the masks work, well, it didn't turn out to be true. And what about our kids? They were forced to learn remotely, stunting their education and their emotional growth. That's a huge reason why we cannot let the lessons from that pandemic be forgotten. So here with us to discuss this is the author of the new book, The Plot Against Kids, which helps our children understand what happened during the pandemic. She also is a board-certified emergency physician, CEO of GoldCare, and founder and president of America's Frontline Doctors, Dr. Simone Gold. Dr. Gold, thanks so much for being with us.
Great to be here, Amanda.
You know, we all heard your name during the COVID pandemic. You were one of the few medical professionals out there who were actually just asking questions about science, making sure that we were all getting the best information. But I don't think I knew until we just talked to you during the break a few moments ago that I think from what you said, it sounds like COVID almost brought you to this place that is, I don't want to say radicalized, but you're in a very different place than you were before.
For sure. I was, practicing emergency medicine for more than 20 years, very mainstream, I would have described myself as very moderate, never really had any conflicts with anybody. And what happened in 2020 was, in addition to the media and the government lying, public health officials lying, the doctors all of a sudden started drinking the Kool-Aid, and it was really just unacceptable. So I just organized a lot of doctors and said, we have to start speaking truth to the American people. So I guess that calls me a radical.
It's amazing. Who would ever thought that speaking truth would be a danger in America? But it was for a period of time. We were censored. We were deplatformed. Doctor, I want to ask a little bit because all of that censorship came with a consequence. It wasn't just bad decisions or bad political manipulation. A generation of children were really significantly impacted by bad policy. I know that's a big part of your book, but tell us a little bit about what we now know about the consequences to that generation of children.
Right. I mean, the effects on the children were terrible and the effects on the family, which is why I wrote this book. In the macro level, I do think it was an attempt to destabilize the American family unit, which, as you know, is really the strongest bulwark against government tyranny. So if they could kind of divide and conquer within the family, that would advance some political agenda. But for the individual children and the individual families involved, it was really crushing. I mean, children were told to be scared. They were told to live in fear. They were told to cover their faces. Children with any kind of learning deficiency at all were especially harmed, right? They couldn't read faces. They couldn't see the social cues. And they were taught to be very afraid. The 6-foot social distancing, we always knew from the beginning was completely fabricated. Fauci testified to this in January 24 under oath that, really didn't come from anywhere. We knew that. But what does it mean if we start telling our children things that are completely fabricated, false, made up, interferes with their life, and then we just kind of go on as though nothing happened? I mean, the children remember what this was like. And they saw the adults around them really telling them things that were not true and that were harmful to children. So I put this together in kind of a very easy to understand, charming, kind of accessible way to explain what was 6-foot social distancing and what were these masks? Like, what was that? In a way that's not scary and in a way that validates the parents, that validates the family, and that children really should look to their parents and the family unit for guidance, not the government.
Yeah. Do you think, as I was referencing at the top of the segment, do you think we've learned lessons from COVID, or if a pandemic came along, do you think we would do the same thing all over again?
I get asked that question a lot. I think we revealed ourselves to have a very weak constitution. I have no play on the words, but we revealed ourselves to really collapse very, very easily. In the scheme of viruses, SARS-2 was no biggie. This was no Ebola. Right? This was a very mild sort of thing in the scheme of viruses, and we just kind of willy-nilly gave up our constitutional freedoms. So I think that Americans right now, I don't think you can pull the same hoax on them, but in several years, I'm afraid that we could, because people didn't protest strongly enough and loudly enough. On the other hand, maybe God graced us that we had a wake-up period, that this was kind of a dress rehearsal, and now we've kind of woken up, and hopefully there's enough of us now that are awake that will not tolerate this encroachment on our liberties.
One of the great casualties of COVID-19, and quite frankly, the period living up, was the doctor-patient relationship. Doctors ended up being given cookie cutter, do not stray from these rules, and medical boards became weaponized to make sure they didn't stray away. Have we fixed the issue of medical boards and their weaponization and their interference in doctor-patient relations?
Right. I actually directly really appreciate that question because I personally tackled the California Medical Board. You may not know that. I fought them for 3 years and I won. And I did it even though I live in Florida because we needed that precedent. California is a huge state. And if they could silence me for free speech, well, they'll be able to silence other doctors after me. And not just doctors, it's anybody with a license, right? What did they do? They tried to crush my livelihood by saying you can't speak about hydroxy or vaccines or ivermectin. And they tried to yank my license. So there is now precedent in California, Gold versus Medical Board of California, that spanked the California Medical Board for doing that. So I think the answer to your question is there are individual cases that have come up. Pierre Corey has one now potentially going to the Supreme Court on these issues of free speech for doctors. So we're holding the line, I would say, and it's with strong, righteous, principled doctors that we're holding the line.
Yeah.
Dr. Gold, I have a lot of friends who just had babies and they're like, we don't know where to find great pediatricians that aren't pushing us to, shove our kids with vaccines. And I said, you need to look up GoldCare because you guys provide such a wealth of resources. Tell everybody about it, what it is.
I can't keep the passion out of my voice on this. So this is my passion project. This is the way forward. If you want to have ethical doctors that are that are there for you, that value the doctor-patient relationship, it's at GoldCare. I collected all the doctors that I met over the last 5 years. Most of them work at GoldCare now. So if you want those answers, and by the way, pediatricians is the most woke of all the physician specialties. It's extremely difficult to find a pediatrician who's not woke. And that's because their entire livelihood depends upon complying with government mandates. So it is a complicated reason behind it. But if you need a pediatrician, a family practitioner, you need any kind of primary, what about if you want to get, be prepared for, a potential COVID or some other issue, you want hydroxychloroquine or you want ivermectin, or you just want information that is accurate and unbiased, it's all at goldcare.com. This is the way forward to provide accurate, unbiased information and to prioritize the doctor-patient relationship. GoldCare. That's the way to do it. That's how you MAHA. Sometimes we say GoldCare.
So
how do you
valuable.
MAHA? You GoldCare.
Yes,
That's
absolutely. Board certified emergency physician and CEO of GoldCare, also the founder and president of America's Frontline Doctors, Dr. Simone Gold. Thank you so much for being with us tonight.
Good to have you.
Thank you both.
Absolutely. All right, everybody, we've got to take a quick break and we'll be right back.